Hello and welcome to Enter the Boardroom with Newroll. I'm your host, Oliver Cummings, CEO of Newroll, a board search specialist and market leader bringing science to the art of board hiring. Today's guest, Cedi Frederick, has over 30 years' experience as a member of the boards of housing, social care and sporting national governing bodies, several housing associations and voluntary organisations. This experience includes over 12 years as a non-executive director of 2 specialist NHS mental health trusts, 2 years as chair of an NHS hospital trust, and 8 years as a governor of Canterbury Christchurch University. He's also represented England at basketball. Cedi is currently chair of NHS Kent and Medway, chair of the Centre for Healthy and Empowered Communities, and is a non-executive director of Sage Homes and Impact Healthcare REIT plc. Cedi, a huge welcome and thank you so much for joining us today.
Ollie, it's an absolute pleasure. Delighted to be here.
Cedi, I'm really excited to talk with you today because we've never done a deep dive in the podcast into either housing association boards or NHS Trust boards. Given your experience in both areas, I thought it would be fun to explore those with you. For someone listening to this podcast who's never sat on a housing association board, can you paint a picture of what it involves?
I think it's fair to say that the world of housing associations have changed significantly since the 1988 Housing Act. One of the things that came in with the Act was the opportunity for housing associations to start securing private investment. Before that, their developments were based on 100% grant from the government effectively. But with the introduction of private finance and mixed funding, it changed the dynamic of housing associations. They had to become much more business-like. Those listening to this from that time would probably say they were always business-like, but even more business-like. They really started to think about the corporate responsibilities that come with raising millions and millions of pounds from banks and building societies. That affected not just how they ran, but also the type of people they had on board. So if I go back to my first few years at Family Housing Association, there's a real focus on tenants being members of the board. But inevitably, as those dynamics changed, as the world in which housing associations operated changed, there had to be much more consideration about actually, do we have the right skills around the board table that meet the expectations of our funders, but also enable us as a housing association to manage ourselves successfully and well going forward.
Can you bring that to life for me by perhaps talking through an example, and maybe we could take Sage Homes. Talk me through how you think about the board's role there. And I'm always really interested in what heuristics board members use for wrapping their heads around large organisations to distill what the key modules that make up that organisation are. What are they for you for Sage Housing?
Sage Housing is a very different model to the traditional housing association in that it is privately owned. So it's owned primarily by Blackstone and Regis, who are investing significant amount of money into providing affordable homes for people across England. And in that respect, the challenge that we have as a board is not just delivering high quality services to our customers, but also understanding the dynamics that arise from having shareholders represented on the board, and also working with companies like Blackstone and Regis who have very much an eye on the return on their investment that comes from doing good work, but nevertheless there is a highly commercialized aspect to that. In terms of the second part of your question, one of the things that I've learned is, as a board member, sitting around the board table will only take you so far. So what I tend to do, which I've done for many years, is in addition to sitting at board meetings and committee meetings, I try to get out as much as I possibly can. And Sage are really good at that, in that they enable us as board members to go and visit their schemes, talk to customers. They have established the customer scrutiny panel that I chair, hear directly from customers, people who are in receipt of the services that Sage offers and provides. I also spend time talking to staff, visiting Sage's offices, and getting under the skin of how they feel about working for Sage. So it's not just about reading papers, turning up for meetings, and making a contribution around the board table, but it really is about getting out and about, talking to people who are on the receiving end of Sage's services. And I find that balance is really important. So anyone thinking about becoming a non-exec director, a board member, I think you have to understand the importance of actually hearing from the people who receive the services delivered by the organisation.
Can you bring that to life for me? I was, as preparation for those, researching the strategy for Sage Homes, and I think you recently announced a move to targeting 30,000 homes, having delivered 20,000 homes. What would be an example of the board coming in and adding that value and that forward-looking, where not being caught in the day-to-day?
Certainly from the Sage Homes perspective, it's really about understanding the landscape in which we're operating. It's about understanding expectations of the investors. It's about high-level risk assessment. We constantly keep testing our risk appetite. You do a deal and it goes badly wrong, or you make a wrong decision, it can have significant consequences. So it's about what's our risk appetite? Are we prepared to work in different ways? I think Sage has been very innovative in how it's worked with developers, many of whom have worked with Sage to establish innovative ways of producing and providing more homes for those who need them. But what's really important for us at Sage is to really take the board's time in understanding the operating environment in which we are working. And that's changes in the regulatory environment, changes in the political environment. We get regular briefings on what's being discussed by government and government agencies that will influence our world going forward. Interestingly, and not wishing to digress too far, but we spent an interesting 20, 30 minutes or so looking at the potential of the change in the US presidential election, for example. All of those factors come into play. Whilst we test through the minutes that are reported of committee meetings, at every board meeting, the chairs of each committee provide a briefing and the rest of the board will question the chair. We spend a lot of our time reflecting on our performance and what we need to adjust going forward, where we need to make additional investment. So Sage is investing significant amounts in its digital platform and its customer portal, for example. How do those things add value to our offer to our customers?
So can you unpick that for me? So for someone listening to this going, okay, they've just spent 20 minutes talking about the US presidential election. What has that got to do with the impact on homes beyond the cost of financing or macro events? How does that translate into practical things that adds value to the organisation?
It's about risk. It's about whether you're prepared to secure a fixed term interest loan, for example, in order to build houses into the future, because if the market becomes volatile, your projections, your planning may be on X% and all of a sudden you're locked into something much, much higher. So in order for us to understand how the financial world in which we operate is going to be affected, it's really important that we have some sense of possibilities and options ultimately on a day-to-day basis in terms of the service that we provide to our customers. No, it does not make a significant difference, because in many of those relationships, they are based on where we are today and how we respond to a question or a repair issue that comes up today. But in terms of long-term planning, which is really important, especially when we're talking about working with developers over a number of years, we cannot do that just in a vacuum.
I may be going down a rabbit hole here, but I'm really keen to go further on that. I'm fascinated to know how you saw those two different outcomes. On the one hand, you said what happens if there's a Republican win and what happens if there's a Democrat win. How do you model the impact of those two different outcomes?
I can't speak on behalf of Sage, but if the Republican candidate is successful, we will see a level of volatility that perhaps we have not seen for many years. The impact of that, because for me, it's not just about what happens across the pond. I think what it may well do to embolden others in other parts of the world, which will have an effect on all of us, must not be underestimated. I'd rather not get drawn on politics too far, but I do think there are third parties who are waiting to see if the Republican candidate is elected. Can they enact plans and strategies they've been thinking about, knowing that there'll be no pushback from the US, no resistance from the US? Now, whether that is, as we've seen with the current Russia-Ukraine war, whether it is China might do with Taiwan, but I think my personal worry is that we could see significant instability depending on the outcome of the election.
Really interesting, because last time, if memory serves, that Trump got elected, actually the markets rallied and I guess cost of capital declined. What makes you think this time will be different?
I think I've heard enough to suggest that perhaps not Trump himself, but those around him maybe feel that they didn't go as far as they wanted to in his first term. They have plans and strategies that they may wish to enact. Depending on the makeup of the three branches in America, they may feel more emboldened to be more radical.
You talked earlier about the amount of time that you spend thinking about risk as a board. What are the risks that you worry most about as a housing association board member?
Certainly financial risks arising from We've just recognised the 7th anniversary of the Grenfell Tower block fire. There are now some very clear regulations about blocks above a certain height, the cladding of those blocks, the condition of those blocks, whether or not they are safe in terms of tenants being able to get out of those blocks safely and quickly in the event of a fire. We've just had an awful fire in East London, of course, just in the last few days, and very early days, but there are indications that perhaps some of the lessons from Grenfell had not been learnt and enacted in that block. The inquiry will no doubt bring out more in that regard. Ultimately, the safety of the customers that we are here to serve in the homes that we provide is absolutely paramount. We do a lot of work, be it around health and safety, maintenance, ingress, water, all sorts of areas to make sure that the homes that we provide are as safe as possible. The financial risk we've talked about, and that's from everything from managing rent arrears to how the supporting customers to secure all of their benefits, for example, all the financial help that they need. I think an emerging risk for Cedi and other housing associations, I'm sure, is the fact that we live in a volatile society at this point in time. So we're seeing increases in antisocial behaviour. For example, we're seeing more neighbour disputes, so there are risks of volatility within the homes that we provide. If we go back to the history of housing associations, one of the things housing associations were doing way back, they would pick and choose the people who would live in their homes because they were the secondary providers of housing. Local authorities provided the majority of those houses. That's changed now because housing associations are working very closely with local authorities to reduce homelessness that we have, and there's less of a choice as to who will be housed. People living with different personal challenges. Some of those will come into development. There may well be tension between neighbours, for example. It's those sort of risks that we've got to manage through intensive housing management, community building, supporting people to live harmoniously together. We have risks in terms of talent. Clearly, we want to hang on to the best people that we've got. We want to recruit and retain the best people. So there are risks in terms of losing those people to other housing associations, other areas of work. It's what's our offer to our staff, for example. Sage invests a lot in supporting its staff, creating opportunities for staff to grow and develop within Sage, and also to enjoy the work that they do. Initiative called Sage Together, where there's all sorts of things to celebrate different festivals, different times of the year, summer picnics, a really successful annual staff conference, for example, and lots of opportunities to spend time talking to the chief executive and his team, lots of breakfast with events. So to create that sense of cohesion and create a culture across the organisation that people want to be part of.
I've talked a lot about, or asked you to talk a lot about, the risks and the challenges. You're still involved in this. You were a CEO in the space and you've transitioned into the non-executive side. For someone listening to this who hasn't had a role in the housing association, why should they want to be involved in this? What are the positives?
The positive, undoubtedly, is that you would be in a sector that delivers life-changing opportunities for people who need it. Ultimately, at the end of the day, we are producing homes for people who really need them. If you, as a housing association, non-executive director, knock on the door of one of the homes that your association has developed and talk to the residents, many will tell you about how, for example, they had to spend 6 months, 9 months in a hostel or in a hotel with a family of 4 in one room. And then to be in a situation where your children have their own bedroom, they have a garden, they can invite friends over, you can have family over. When you hear stories about how people are sleeping better, how children's work at school has improved, when you hear those stories, that's what really makes this work so important and so vital and so rewarding. Ultimately, we know that there is a challenge out there, and non-exec directors will have or choose to have mixed portfolios, but I'd always be suggesting that they should be considering applying to join the board of a housing association, because in addition to being part of a successful business, because that's what housing associations are. If I think about our largest housing association, they provide 120,000 homes across the country. Those homes are for 400,000 people. They have a turnover of £1 billion, and in 2022-3, they made a surplus, not allowed to call it a profit, but a surplus of just under 100 million. So these are large complex organisations providing a range of housing, not just affordable homes, but homes at commercial rents, shared ownership, all sorts of different homes. They provide homes for people with special needs. There's all sorts of homes within a lot of the portfolios of these housing associations. But at the end of the day, it's about those individuals living in those homes and giving them the best life chances that they can going forward.
So that's been a brilliant introduction to housing association boards. I'd love to do the same now with NHS Trust boards, because again, you've done several of those boards, so I'm guessing you find them a worthwhile experience as well. Can we bring that to life a bit more by doing a deep dive into your role as chair of NHS Kent and Medway? As the chair, I imagine you have a view of the organisation. What are the key levers and what are the key areas that you focus on?
Happy to. And perhaps the thing to do for listeners who are not familiar with the NHS is just to talk a little bit about how we got here. So the NHS has just celebrated its 76th anniversary. What we have found over the years is that only 20% of a person's health and being sits at the door of the NHS. 80% of people's health and being are very much governed by where they live. You mentioned earlier about warm, safe houses people live in, the level of their income, the level of education. We talk a lot about health inequalities. Reducing health inequalities is a big mission for the NHS. So the NHS has been working over some time to acknowledge and recognise that actually the NHS cannot operate in a silo. If we are to improve the health of the nation, we can't just keep delivering more and more services at the hospital end. We've got to reduce people's reliance on the NHS, and we need to do that working in partnership. So in 2021, there was a proposal to develop a new Health and Care Act, which would enshrine in legislation the need for the NHS to work in partnership, work collaboratively in ways it hadn't done before, with local authorities, district councils, the voluntary sector, education and others to consider the wider determinants of health. So I chair NHS Kent and Medway. We oversee the health system in Kent and Medway, which has a population of just under 2 million people. We have a budget just over £4 billion a year, and we use that budget to commission others, including hospitals and other organisations, to deliver services. Within Kent and Medway, we have 4 acute hospital trusts, a mental health trust, a community trust, and other organisations who deliver services. Our role is to commission those services. It is to bring those providers of health together as an enabler, as a catalyst, to encourage them to work differently going forward, to work much more. It's about being a leader along with colleagues from our local authority. So we have that overlap, working together with public health on things like prevention, for example. How do we reduce the number of people who turn up at A&E? Now, some will talk about the fact that we've had more GPs, and we could do that. We know there's a challenge there. We don't have enough GPs and we don't have enough primary care clinicians. So our role is to coordinate health across a large population, bearing in mind that each NHS Trust is its own sovereign organisation with its own chair, its own board, its own chief executive. So my role is to work with the leaders of our health services across Kent and Medway, who we describe as our NHS family, to work much more collaboratively, to drive efficiency across our system, to reduce variation, because there are parts of our system that we have trusts that are really good at doing some things and a little less good at doing other things, and vice versa. So how do they learn from each other? There was a time in the NHS where the mantra was competition. It was a view that if you drive competition, it will drive up standards, reduce costs and so on. That didn't really work in the NHS. So now our challenge is, how do we collaborate? How do we work more closely together? It shouldn't matter what your postcode is in terms of the service that you receive, the quality and safety of that service. It should be the same whether you live in one part of Kent or one part of Medway. It shouldn't matter. Does that make sense, Ollie?
Yeah, I mean, completely eye-opening and inspiring to hear the incredible impact you're having. I think that stat around only 20% of being is determined by that acute hospital end of things was particularly striking to me. And the total managed expenditure is allocated towards healthcare. Have we got that wrong?
Well, I think it's fair to say, and we've heard this from successive governments of different persuasions, we cannot keep spending more and more money on the NHS. We have an ageing population. In the next 15 years, the number of people over 75 will double from 5 million to 10 million. We have a population that is sicker, more obese, People are living with 4 or 5 comorbidities now. More and more people are living longer but in poorer health. So our challenge is, and this is why working collaboratively with colleagues in public health, with the voluntary sector and others, our challenge is to help people, encourage people, support people to live healthier lives for longer. Now, that's a challenge for government, and it's a challenge for the Treasury within government. We understand that. But that balance between ensuring that we talk positively about what the NHS can do when you need it. But now the NHS is spending more and more time and resources on what might be described as lifestyle illnesses. If you look at the increased number of people with type 2 diabetes, for example, that's taking up more and more of the NHS's time. What, of course, we want, if we're ever unfortunately in a car accident, we want that blue light ambulance arriving within minutes. We want to be taken into the hospital and we want to be looked after and supported to get well and back on our feet. But the NHS is spending more time resourcing illnesses that are lifestyle related. And if we think about the number of young people who are overweight or obese, for many of those people, the young people, in 5-10 years, they'll be pre-diabetic. A further 5 years, they'll be type 2 diabetic. What we see, of course, is that inequality I mentioned played out across the country. If people can visualize the county of Kent, if you know it, M20, the M2 motorways go east to west. If you go from west to east, there will be a difference of 10 to 15 years of healthier life expectancy the further east you go. So how do we work together to reduce those health inequalities? We hope the government will work together. Different departments within the government will come together to put the health of the nation up to the forefront of their minds. We've heard Wes Streeting, the new Secretary of State, talk about health as an economic driver. We talk about the number of people who are unable to work because they're on waiting lists and waiting for treatment. If we can get that, we'll get more people back into the workplace. Being what we call an integrated care board, which is what NHS Kent and Medway is, much of my time is spent in discussions with others looking at that. So working collaboratively, workshops, coming together to talk about health and work. How can we get more people who are disabled or more people who are in need of support back into the workplace? Very important. So it's not just the people see on their TVs when they show programs about A&E departments and ambulances whizzing back and forth. What we're trying to do here is very much about how do we improve the health of the nation, because we can't keep spending more and more money on the NHS. The Treasury won't allow it. We just don't have the money. But there's more that we can do. To be a non-exec director in the NHS, in my humble opinion, is an absolute privilege. And I know that I get accused of being quite emotional about these things, quite passionate, and that's what motivates me, that's what drives me. But ultimately, it really is about what role can we play? How can you bring all of your experience, be that a commercial experience, education, all of your experience, lived and professional, into a place where you can contribute to the health of the nation. It's vital work.
I've talked in the past about Reid Hoffman's line where he rails against the gifted amateur board member, which is smart people from successful other backgrounds assuming they can just come in and roll into a new sector and sort everything out. I often hear people saying is what happens in the NHS, where people come in and say, oh, well, this is how we do it in the commercial world, quote unquote. We have competition and so that'll work here. You've obviously had huge amounts of experience in this sector. I'm curious to hear, for someone listening to this who's coming into the NHS for the first time as a board member, if you could distill the 3 or 4 key mistakes new board members making that you would counsel them to guard against.
Happy to do that, Ollie. But before I do, could I just make a quick plug? We need more people to apply to become non-exec directors in the NHS. I think people underestimate just how complex the NHS is. It employs 1.4 million people. It's the 4th largest employer out there after the Chinese army, Walmart, or the US Army. It's a huge, complex organization. People who come from the private sector get really frustrated just how long it takes to do anything. I get frustrated at the meeting for meeting's sake syndrome that sometimes we can fall into. Understandable reasons, I would argue the NHS is quite risk averse, because in some sectors where mistakes are celebrated and you're encouraged to take risks, you take risks in the NHS, bad things happen, and it can be career ending. So people are quite risk averse, and understandably. So I think a lot of people coming into the NHS just find it really difficult, because things take a long time to change, a long time to get done. And I think people find that difficult. I've had people say to me, why can't we do this? Because we are not a company, we're not a single organisation. We're part of this massive entity, and we take a lot of our lead from the centre. NHS England will provide guidance and applies to the whole of the NHS. So we have more freedom now following the 2022 Health and Care Act than we did before, but we're not fully utilising the freedoms that we do have. So there's more flexibility now. And as someone said to me, now it's about asking for forgiveness, not permission, which is perhaps a good way of doing it. I think the NHS is very hierarchical. And I think in terms of accountability, most of us look upwards, the next level up in terms of who we're being held to account by. Part of our challenge is to establish an accountability framework where we are being held to account by the people we are here to serve. When I talk to my local authority colleagues, they talk about the democratic deficit. They say, Cedi, no one elected you. I'm a councillor. I've got to put myself up before the electorate every 4 years. You went through an extraordinarily difficult process to become chair of NHS Kent and Medway. Once you're in that role, you've got a 3-year contract, and it may well be rolled over if you want to, and they want you, and so on and so forth. It's a different way of operating. And I think if you've been used to working in a company or in a business or in a sector that's agile, that can respond quickly to external events, people get very frustrated with the NHS.
Patience is the watchword.
Patience to a degree. I think I'm known as someone who can be quite impatient. And I think my motivation for becoming a chair was to be in a position where hopefully I could influence the pace of change, our willingness to take risks, more than being a non-executive director.
Now, before we go on to the lightning round, I just want to zoom out and talk a little bit about your portfolio career. Maybe first up, before we go further there, have you faced discrimination in the boardroom?
I think the answer to the question that you ask is no. No one looks across the board table at me and calls me a name, or no one will make a disparaging comment about me, my ethnicity, or anything of that nature. Have I felt there are times when actually my views are not considered with the same degree of seriousness as the views made by others? Absolutely. I give talks where I share my story. People have been intrigued by how the son of Windrush, brought up in a single room in a shared house, ended up to be chair of a large organisation like an integrated care board. And I talk about times where I felt that I've had to swallow the bile. So I've intuitively sensed in a meeting racism. And there have been times when I wanted to call it out, but then I've just held back. I swallowed the bile. What I wanted to say has got stuck in my throat, and I've reflected on the impact of what I want to say having on the whole board and the relationships on the board and so on and so forth. I think it's fair to say that within and across the NHS, it is challenged in the equality, diversity, and inclusion space. If you look at the staff surveys, staff from Black and minority ethnic backgrounds regularly report that they have a less positive experience than others. And that gets transmitted in many different ways, but it does get transmitted straight to the board. I mentioned earlier that I was chair of a hospital in London. At the time, there were 230 plus NHS trusts around the country. I was one of 10 Black and minority ethnic chairs of those plus trusts. At the time, we only had 8 chief executives from ethnic minority backgrounds out of 230-something trusts. Things have improved. The NHS is working to rebalance that because there is tremendous talent within the NHS.
Are there any patterns of success where you've seen boards successfully combat discrimination?
Listeners will recall the impact that COVID had on ethnic minority communities. We saw the disproportionate impact of COVID on communities of colour. We were all pleased when the vaccine was developed and it started to be rolled out. At the time, during COVID, I was chair of a hospital trust in London where 64% of our staff were from a Black, Asian and minority ethnic background. So I was able to see at first hand the impact of COVID, not just on our staff, but on the communities we're here to serve. I became quite vocal because I felt the NHS could and should be doing more to support those communities. When it came to the vaccine rollout, the data soon showed that whereas white communities were coming forward in their droves to be vaccinated, communities of colour were not coming forward. And that surprised people within the NHS and within government. You had white people literally queuing around around the building to get vaccinated. Black people, brown people were not coming forward. Colleagues at a senior level in the NHS reached out to me and asked me for my views about why that was. And I was able to talk to them about the fact that those communities did not trust the NHS, did not trust the vaccine. But it wasn't just the NHS. There's a lack of trust in the education system. There's a lack of trust in the judicial system. Every black person in London knows someone who's been stopped and searched by the police. So it wasn't about not trusting the NHS, although there were lots of talk about the origins of the vaccine and so on. But there was a much bigger challenge there. Yes, I was stopped and searched as a youngster. Yes, I have been stopped in my car because I'm very fortunate. I've got a nice car. Is this your car, sir? Yes, officer. I was able to bring that knowledge into the discussions, and we established a strategy which became known as trusted people in trusted places. We know the black community, many of them have very strong faith. And if their pastor said, I've had my vaccine, why haven't you had yours? We saw a spike in vaccine take-up in that part of London. So we started developing community champions, enabling leaders at a local level. They may have been the pastor, the local barber, or the nail salon lady, or whatever, but local leaders who would answer questions about concerns people had around the vaccine. And over time, we saw the vaccine take-up increase. We're now using those same principles to try and drive an increase in the take-up of vaccines, screening, and immunization. If you look at the figures amongst certain communities, that take-up is very low. So we're using the same principles to try and get local leaders to be in the forefront of engaging local communities in this space.
Cedi, time has flown by, which means it's time for the lightning round, where I'm going to say a short statement and ask you for a quick response if you're ready.
I'll try.
Best book every board member should read and why?
Maverick by Ricardo Semler. I don't know if people have read the book or know about Ricardo Semler, but he is a Brazilian industrialist. And his father ran a large industrialized business with a very autocratic style. They used to search the workers when they went home on the way out from their shift. Ricardo Semler took the business over at age 21 because he threatened his father he was going to walk away from the business. So his father basically handed the business over to him. And on his first day, he sacked 60% of the senior managers across the business. And he created a culture within that business where there was a high level of self-determination, there was absolute accountability. There was an example in the book where, unfortunately, because of a downturn, they had to make some decisions about letting some staff go to downsize. Bizarrely and interestingly, it was the staff who made the decision. It wasn't the management. So creating a culture where individuals are so engaged in the business, they feel so much part of the business, there is trust from top to bottom. Imagine being searched when you leave a shift. There's no trust. He changed that around, and I think over 20 odd years, the business grew from a turnover of 4 billion a year to 22 billion a year, something like that. Extraordinarily successful. Why should board members read it? Because one of the challenges that board members have is that they only ever get a snapshot of the organisation, and to get a sense of how successful organisations that work in what I call human services need to work to be successful, it's a must read.
Boardroom behaviour that irritates you most?
There's two: grandstanding and gotcha questions.
Most valuable boardroom ritual?
I think it's one that we have at Sage, and that is where we as a group of independent non-executive directors meet the chief executive once a month for an hour or so. He's able to talk to us in a very unfiltered way. We're able to ask questions and get direct feedback.
Favourite quote? Real
change only occurs when the cost of not changing outweighs the cost of the change. All too often, we get to a cost of change moment where we have no choice. And that's the most powerful point we can get to.
Most significant professional insight?
Network, network, network. A piece of advice was given to me way back. Diarise half a day a week to network. It's easier now because you can have a virtual coffee on Teams or Zoom or whatever. In those days, it was picking up the phone, talking to people, learning from people, not being afraid to ask for help. Network, network, network.
Worst professional advice you've ever received?
I mentioned I started my career in housing. I worked for a London local authority and had ascended the greasy pole to a point where I was being talked of as a future director of housing. After 14 years, I decided to leave and I became chief executive of a housing association. I mentioned my by wanting to learn about housing associations. And a colleague said to me, "You can't leave now, Cedi. What about your pension?" It went down like a lead balloon. I couldn't believe there were people there. They got to a point where they became a local authority lifer, and all they thought about, 5 years to my pension, 4 years to my pension, and they stopped losing their drive. Their only commitment was to avoid the next reorganisation so they get their pension. Awful.
What have you changed your mind on about boards over time?
Successful boards balance art and science. In my early days as a board member, I was fixated by the data numbers, fixated by the graphs and so on and so forth. But actually, much about those softer, qualitative themes that we talked about earlier.
When was the last time you got a significant judgment call wrong in the boardroom, and what did you learn?
Can I reflect on my time as a chief executive? We did some work with the board around risk, and risk appetite, and it became very clear that there was a difference in risk appetite between the non-executive directors and the executive directors. I should have recognised that. I came back to the board sometimes later with an opportunity to effectively take over another organisation. They were struggling and they needed help. And I misjudged the fact that the board's non-executive directors' risk appetite would mean that they would not sanction that. We used to call it a merger, but we knew what it meant. So I'd done a lot of work in discussion with the chair and individual board members, and they'd said, yes, makes sense, Cedi, yes, makes sense. When it came to sign it off, they chose not to. And I learned from that, you have to work and understand where your non-exec directors are relative to your ambition as an exec director and vice versa.
How are you better today as a board member than when you started?
I'm a much better listener and I ask better questions. When I started full-time work in 2015, I started my own small consultancy and became a coach and mentor. I learnt about the importance of listening with a quiet mind. All too often we listen already having made our mind up about the situation, the answer we're going to give, and so on and so forth.
Finally, 3 things our listeners should take away from this podcast if they take nothing else.
If you are a non-executive director and you're not getting out listening to people who are in receipt of the services you offer, you need to do that. Really listen. When you receive your papers, of course, you'll go through them and make notes in the margins or on your iPad or whatever. But in the board meeting, listen to the views of others, because that's how a board is successful, when others feel able to bring their knowledge into that conversation that may influence your thinking and your approach. And I guess the last thing is it's harder work than you might think. If you want to become a board member because of the money or another notch on your CV, in my humble opinion, that's not a reason to do it. It's hard work, and to be successful as a board member, you've got to commit to do the work.
Cedi, that has been both inspiring and hugely informative, the hallmark of all my favourite podcast episodes. Thank you so much for taking the time to share your experience and wisdom.
Ollie, thank you very much, and thank your colleague at Newroll for giving me the opportunity to just share my thoughts.
If you found this conversation interesting and would like to be involved in similar discussions, join the Newroll board community. Community membership gives you access to 24-hour discussion threads on boardroom challenges and opportunities like those we've been discussing. Smart online networking events, one-to-one career sessions with our headhunters, third-party board roles, mastermind groups, and Q&As with senior board members. Head to community.newroll.com to find out more.